The total number of cases in a suspected Hantavirus outbreak aboard the luxury MV Hondius cruise ship has risen to 7, as roughly 150 passengers have been ordered to stay put in West African waters, according to authorities. As of Monday, 7 cases, including 2 laboratory-confirmed cases and 5 suspected cases, have been identified in the suspected outbreak of the rare rodent-borne illness on the Dutch cruise liner, according to the World Health Organization. The cases include 3 passengers who died, 1 critically ill patient, and 3 people reporting mild symptoms, WHO said. The passengers reported illness onset between April 6th and 28th and experienced symptoms including fever, gastrointestinal symptoms, rapid progression to pneumonia, acute respiratory distress syndrome, and shock, officials added. Detailed investigations are ongoing, including further laboratory testing and epidemiological investigations, WHO said. Medical care and support are being provided to passengers and crew. The doomed vessel, which is carrying 17 Americans, was on a weeks-long polar cruise from Argentina to Antarctica when trouble boarded early last month. The fatalities include a 70-year-old Dutch man who died on April 11th after developing a fever, headache, abdominal pain, and diarrhea. His 69-year-old wife died weeks later as his body was being transferred to South Africa. Her blood later tested positive for Hantavirus, officials said. A third passenger, identified as a German national, died on the ship on Saturday, where his body remains, according to ocean-wide expeditions. A British man was also evacuated to South Africa on April 27th and tested positive for the virus. He is now in critical condition and isolated in intensive care, health officials added. Officials are attempting to coordinate the evacuation of 2 ill crew members, 1 British and 1 Dutch, who require urgent medical care and have begun presenting respiratory symptoms. Dr. Anne Lindstrand, a WHO official in Cape Verde, told the Associated Press that there is an additional possible case of someone with fever symptoms. Health officials are still assessing the individual. Cape Verde's health ministry ordered that for now the luxury cruise cannot dock and must stay in open waters close to shore over health concerns. Investigators are now rushing to probe what is causing the infections and whether the other passengers and crew members are at risk. Health officials have urged people not to panic, as the WHO coordinates a multi-country response to contain further spread of the potentially deadly disease. While severe in some cases, it is not easily transmitted between people, Dr. Hans-Henry P. Klug, WHO Regional Director for Europe, said in a statement Monday. The risk to the wider public remains low. There is no need for panic or travel restrictions.